Oh, I am Dr. Sugar McFarland. I'm a clinical psychologist. I have my own private practice, Transformative Health, in Columbus, and my expertise are child and adolescent youth and families, and also working with youth who are traumatized and in a part of multiple systems. And so throughout my career, I have worked with families that were dealing with being unhoused. It's very common in families that are dealing with domestic violence to have to separate and to have a family leave and go somewhere else. And so that could be on the street, in that car, or in a shelter, or living with friends and family. And so that's what we'll be talking about today. How do we support our youth and families that are unhoused? So you may have heard some of these terms: homeless, houseless, unhoused, or unsheltered. Why do we have all these different terms? Well, it's due to the stigma that's associated with being homeless. When people hear that you're homeless, it brings on a lot of beliefs about the person that is homeless. Things like, what did you do to be homeless? Do you use drugs? And other just stigmatizing associations. It can minimize the effect of, does your family come from wealth? Do you have somebody else that you could rely upon in difficulties? Are you disabled? What type of resources are in your community if you're having difficulties? And other crucial factors that may be associated with why a family is unhoused. So terms like houseless, unhoused, unsheltered, or people without homes humanizes people. It makes their living situation their current state and not their permanent state. Also, some unsheltered people really resent the idea of us saying that they have no home. Some people may view a community area or a park as their home. Now, when we say unsheltered, that's talking about a family or a youth having a lack of a physical shelter. So while homeless may talk about the lack of permanent housing, people that are unsheltered are people who live in their cars or in temporary shelters or with. So when we look at the government's definition of homelessness, we're describing a person who lacks a fixed or regular nighttime residence. The total number of people experiencing unsheltered homelessness in 2024 has reached the highest count since reporting began in '07. On a single night, about 20 out of every 10,000 people in the US were experiencing homelessness. 6 in 10 people were experiencing sheltered homelessness. That means that they're in an emergency shelter, transitional housing, or in some type of safe haven program. While the remaining 4 in 10 were experiencing unsheltered homelessness. That means that they were in places that were not meant for human habitation. Chronic homelessness is when a youth or a family has been continuously experiencing homelessness for a year or more, or has experienced at least 4 episodes of homelessness that altogether would equal up to 12 months. So between 22 and 23, the number of people experiencing homelessness increased by 12%. People of color continue to be overrepresented among populations of people experiencing homelessness, and most people experiencing homelessness live in urban areas. About a third of the people experiencing homelessness are families with children, and we have seen those numbers have been increasing, especially since there was a downward trend that started in 2012. And so we can look at the screen at some specific information about Ohio's population count. Now, this is the most updated information that we have. This was published in 2025, but this talks about they will do a point in time count where they will look at one night and count the number of individuals, families, children, and veterans that are homeless or unsheltered. And so when you look at the screen on the top left, I don't know on my right side to do that. So when you look at the top left, you see the trends of Ohio's homelessness. And we can see since 2021, just like what is happening nationally, we see that number going up. And I don't know if you've been outside, but gas is $4.99 currently a gallon. With the economic instability that is going on, all the indicators are that these numbers are likely to continue or may actually spike since we're having such a specific quick increase in terms of what is happening in terms of our economic. So we can see that overall, when we look at the populations on that right, on the top right graph, we see that between the green shows 2020, and we can see in 2024, outside of for veterans, we see a significant increase in each area. And at the bottom, we can see that since the pandemic, um, Ohio has had a 10% increase in our homelessness population. Now, youth experiencing family homelessness are more likely to have more mental and physical health problems than youth who are housed. Amongst unhoused youth, you see higher rates of depression, anxiety, substance use, psychosis, as well as suicide attempts. These youth are more likely to be diagnosed with externalizing disorders like ADHD or oppositional defiant disorder. This can affect a family's ability to gain housing, as aggressive and impulsive behaviors are often things that will lead a family to be removed from a shelter program. Youth who are alone are at an even higher risk. These risks include mental health stressors, being victimized, infectious diseases, and substance use, or a combination of both mental and physical health than their peers who had consistent. So, ACEs, adverse childhood experiences. So, unhoused youth have higher rates of trauma or ACEs. This trauma occurs not only before they were unhoused, but also during their period of not having housing. And this is what I often saw working with my domestic violence clients, that not only did they have to leave and find housing, but then dealing with traumas of like in terms of dealing with the mental health system and trying to start that, dealing with the criminal justice system and trying to deal with that, dealing with child protective services and trying to find a place to stay. So when we look at the research on ACEs, they found an average of 0 ACEs for house youth, 1 ACE for youth who are homeless with their families, and youth who are alone averaged 2 ACEs. The same outcome was seen when we looked at health status. The healthiest youth were those who were housed, and the middle were youth who were homeless with their families. And the youth with the highest level of problems were those who are unhoused and alone. Youth that were unhoused and alone are more likely to have chronic mental health problems or a combo of both mental and physical health problems than youth with consistent housing. Feminine youth also have a particular difficulty when being unhoused. They may be targeted specifically in sexual ways or may need to use their sexuality as a way to survive. Transition age youth and young adults between the ages of 16 to 25, they have different challenges as they go from being dependent on someone to independent living. About half of the youth in this age range who experience houselessness will go on to experience it as an adult. Another grouping of youth who are particularly affected by this problem are youth in the juvenile justice and foster care system. About a quarter of youth, about a quarter of youth who leave foster care spend their first night in a shelter or on the streets. Youth in juvenile justice are less likely than their peers to get either housing or financial support from their families. They also may face more difficulty finding housing for themselves, as committing certain crimes stops them from qualifying for public assistance. So, overall, what the research tells us is that part of the reason why it's hard to engage these youth or why they have some of these treatment challenges is that they often have other demands, whether that's trying to find a place to stay or trying to find finances. Some of the treatment challenges that these youth face are that they're more mobile, so giving them care in one place can be difficult. They often don't have chronic medical conditions. Adults who are not good with medical appointments will go to an appointment because of their chronic condition, will lead them into treatment. Youth don't have that push. Houseless youth have a lot of stigma and fear associated with institutions and the people that work for them or in how important the treatment is to them can be another barrier because, again, you're trying to deal with finding a place to stay or finances, trying to eat today. And another big thing is just overall having time to do. So, some of the different treatment types we see are listed here, but overall, getting homeless youth into treatment can be difficult. While treatment, what the research shows us that overall, while they may engage in treatment, there's often a very sharp decline once they start. When we look at mental health treatments for houseless youth, family-based interventions like MST, multi-systemic therapies, have been found to be effective with these youth. These type of therapies look at family functioning, trying to have a more positive family interaction, and increasing family problem solving. When we look at specific family interventions, research found that parents that had more money, less conflict, and were more anxious were more likely to actually complete treatment. For teens who completed treatment, they reported being more depressed, anxious, having more symptoms in their body, being more obsessive compulsive, worried, and having more psychotic symptoms than those who did not complete. This may show that families with greater stressors and more anxiety about their stress may be more likely to complete these interventions. Another factor that seems to also help keep families in treatment was using cultural humility, talking about the health disparities they face and the other difficulties that they're facing in their life due to being houseless. Another interesting finding is that teens who are more comfortable talking about sex with their parents had stronger connections with their therapists. And the researchers thought that this may happen because the youth may already come from a culture of having more difficult conversations. Some of the other ways that they've looked at treating this population is through cell phone programs. One program gave you a cell phone that had mental health app, and that helped to track their moods and sleep, gave them tips and the opportunity for 3 coaching sessions from a therapist. And they also received a month of prepaid data. Of the youth who engaged in this the most, those youth found the treatment to be very helpful. A study in Chicago followed 100 shelter-based youth for up to 6 months using a cell phone-based intervention. One of the problems that they found was it was hard to get the youth to remain in the program. At the halfway point, under half of the youth remained in the program and only 19% completed. One of the things that they thought that has been indicated by the research is that it's very important in this population to not only focus on their traumas, but to also focus on ways to help them regulate their emotions. For youth with substance abuse difficulties, they found that behavioral approaches that add in community reinforcement, which is basically how a person gets rewards from their social community for behaving or being sober, was the most successful. Some community based programs have looked at reducing trauma and runaways in adolescents that experience sexual abuse. They gave them community visits by nurses and also offered them empowerment groups and other interventions. Some of the approaches of organizations that specifically work with these youth use the housing first model. This model looks at how shelter in and of itself is a mental health treatment. And so recognizing that housing is more important than actually providing health treatment. So research has shown that these type of models are more likely to lead to housing stability among the youth. And these programs also typically add in education and job training. Another thing that has been helpful for homeless youth is having intensive case managers that are dedicated to the youth. These case managers have low caseloads so that they can focus on these youth as they generally have more intensive needs, and they can also give them more intensive services. Another treatment model that has been successful is using peers. Many houseless youth report having negative interactions with healthcare and mental health care. So while using peers can provide support, education, and resources, the overall question is, what is the best way to train these peers? And what are the most effective things that they can teach their peers? Now, Ohio, at the latest numbers that we have, has over 24,000 students experiencing houselessness. And a houseless education liaison or a homeless education liaison is required in every district and community school. And this liaison works with the families, community agents, and partners to best support the students. And so this link here is a way to get, you can email to look up and be connected to the liaison in your district. And this is another resource about youth homelessness under the Ohio Department of Health that you can also go to if you're working with a family or a youth that is experiencing homelessness. So here are the references. And if you have any further questions, you can always email me. And I do not know if I have time for questions. So thank you all so much for your attention. And I hope this can help you to be able to support our community, because as we can see in terms of what's going on in our local economy and also the national economy, this is very important.